Everyone, welcome to Yoga Vidya Gurukul, YogaPoint, Yoga Therapy Training Program. We will be talking about hypertension, high blood pressure. Now, every human being, every normal individual has blood pressure, and this blood pressure is defined as a continuous physiological variation. So, our blood pressure is never constant. It changes by many things in our life. It can change with our emotions, it can change with our physical activity, it can change even with our food. So it's called as a physiological variation. However, someone having a blood pressure of systolic 140 millimeters of mercury or a diastolic blood pressure of more than 90 millimeters of mercury is considered as a person having high blood pressure or a person having hypertension. Systolic blood pressure is the pressure exerted by the blood in our arteries when the heart goes in a stage of contraction. And diastolic blood pressure is the blood pressure of the blood exerted in our arteries when the heart is relaxing. So systolic blood pressure is when the heart is contracting, and diastolic blood pressure is when the heart is relaxing. So someone having a blood pressure of 140 millimeters of mercury and 90 millimeters of mercury is considered as a person suffering from hypertension or high blood pressure. Now, in a normal individual, what are the factors which can affect, which can change our blood pressure? As simple as age. In young age, the blood pressure is comparatively lower as compared to the old age. As the age goes on increasing, the blood pressure it can go on increasing. Similarly, gender, like in men, usually the blood pressure is towards a higher side as compared to women. Usually, women they have low blood pressure, hypotension it is called as. Then even the hour of the day or the food or the body posture, these simple things can affect our blood pressure. During morning hours, the blood pressure is the lowest. And as the day progresses, as we start with our mental and physical activities, the blood pressure goes on increasing, and by the evening time, the blood pressure is the highest. So, comparatively, in the morning, we have a lower blood pressure, but by the evening time, we have a higher blood pressure. Similarly, food, hot food, spicy food, it can increase your blood pressure. Posture of the body, when you are lying down, the blood pressure is a bit low. When you are sitting, it slightly increases, and when you are standing, it is more. So there are some people who suffer from maybe dizziness when they're changing their postures. Some of you also might have experienced it. That when you're changing the posture from sitting to standing, or even from standing to sitting and directly lying down, the blood pressure changes quickly and there can be a slight dizziness. So even the posture of the body, it can affect our blood pressure. Furthermore, exercise and emotion. If you exercise, if you are running, if you are cycling, if you are swimming, slightly the blood pressure can increase. And at the same time, extreme emotions, anger, for example, can increase your blood pressure. Environmental factors like in hot summer seasons, the blood pressure is slightly on a higher side. If you are sitting in a hot room, the blood pressure can slightly increase. But if you are sitting in a well ventilated, cool room, the blood pressure would be slightly towards the normal. Even the mental and physical activities of our body and mind, they can have an influence on the blood pressure. So all these multiple factors, they keep increasing and decreasing our blood pressure throughout the day. And so it is called as a physiological variation. But the body has a mechanism to keep the blood pressure within normal limits. And the normal limits are 120 by 80 millimeters of mercury. So if this mechanism disturbs, and if the body is not capable of maintaining the blood pressure within the normal limit, if it increases beyond the normal limit and it remains constant at a higher range, then we call the person suffering from hypertension, high blood pressure. Now, what are the causes of hypertension, high blood pressure? So when we go into the causes of high blood pressure, the etiological factors, the risk factors of blood pressure. Blood pressure mainly is classified into two types. High blood pressure is classified into two types. The first type is secondary hypertension. And there are very few cases of this secondary hypertension, maybe not more than 15% of cases of high blood pressure, they are having this secondary hypertension. So what is this secondary hypertension? It means that the blood pressure has increased because of some disease of the kidney, renal disorders, or there is a problem with the heart, cardiovascular problems, or there is a disease of the endocrine system, the hormonal imbalance, the hormonal system of our body, or the blood pressure can slightly increase during pregnancy or as a side effect of certain medicines. So here the blood pressure has increased because of problem in some other organ of our body, or it's a variation because of pregnancy, or it's a side effect of the medication. So here in nearly 15% of cases the cause of high blood pressure is very well known, and so it is called as a secondary hypertension. And it's but obvious that if you know the cause why the blood pressure has increased, you have to treat the cause and the blood pressure will come back to normal. So this is what we call it as the secondary hypertension. Next, the second classification of hypertension, high blood pressure is essential hypertension. Now nearly 85 to 90% of cases of people all throughout the world suffering from high blood pressure, nearly 85 to 90% cases are coming under essential hypertension. Now, what is this essential hypertension? Basically, when you don't know any specific cause why the blood pressure has increased, we call it as essential hypertension. So it's a combination, it's a manifestation of several multiple factors. It can be stress, it can be emotional disturbances, it can be too much physical activity, it can be the food, or a combination of all these things. So, when there is no exact cause known and it's a manifestation of several factors in our life, then we call it as a essential hypertension. But the ultimate effect of all these factors is that it stimulates the sympathetic nervous system, or it is the hyperactivity of the sympathetic nervous system which increases the blood pressure in our body. So it can be food, it can be stress, it can be anger, it can be some different emotion. So all these factors, they would stimulate, they will hyperactivate the sympathetic nervous system, which will increase the blood pressure. And this type of blood pressure is called as essential hypertension. And I would like to remind you again that nearly 85 to 90% cases are essential hypertension where the exact cause is not known. And when there is no exact cause known, a holistic approach towards the treatment of these cases is very, very necessary. Now, there are some factors which are considered to be the reasons of essential hypertension. One of them is increased renin secretion. We'll be talking about this renin in a short while. Another thing is expanded vascular volume. Too much of fluids in the vascular volume, too much of fluids in the arteries and the veins, too much retention of fluids within the arteries and the veins is called as expanded vascular volume. Then, of course, everyone knows increased intake of salt and retention of salt. Now, this retention of salt or increased intake of salt, it is one of the reasons for expanded vascular volume because the more salt you eat, more water is retained in the body. So the total quantity of fluids it increases in the body, which causes increase in blood pressure. Then conditions of the arteries like deficiency of vasodilatation, or in simple terms, the artery they're elastic. So if they don't increase in their diameter, then it is called as deficiency of vasodilatation. The size of the arteries is quite flexible. It should increase and decrease in size. Increase in the diameter of the artery is called as vasodilatation. So if it is not happening, if it is deficient, it can lead to high blood pressure. And why there is deficiency of vasodilatation? One of the reasons is atherosclerosis. This is a quite popular word, atherosclerosis. This is hardening of the arteries. The arteries, they lose their elasticity. But then no single factor out of all these things can be blamed for high blood pressure, and then we call it as essential hypertension. So it would be a combination of these factors and also the lifestyle or the lifestyle factors all together they would cause a hyperactivity of the sympathetic nervous system leading to high blood. Now, what factors they influence this blood pressure? Commonly hereditary, yes, essential hypertension is usually hereditary. As mentioned earlier, with age, slightly the blood pressure goes on increasing with the age. And in men, of course, it increases with age. In women, it is more, or the increase in blood pressure is more after menopause. Then everywhere we can blame stress for the disease condition. So even in essential hypertension, stress can be one of the factors. And of course, because of stress, there would be more sympathetic activity. So stress can always be blamed. Then it's a very well known fact that habits like smoking or alcohol or eating fatty food, they are also risk factors for the development of high blood pressure. Similarly, overweight, obesity, and people suffering from diabetes, the chances, the risk of developing high blood pressure is increased in these people. And those people who are always stressed, as we mentioned earlier, the chances of high blood pressure are more. Usually, we call people who are having the hurry, worry, curry type of personality or type A personality. Hurry is they are constantly stressed, or they are mentally and physically constantly busy. They are in a hurry. They are also in a worry. They are stressed. They are anxious about their work, about their life. And curry means they are having spicy food. So these kind of people, and along with spicy food, maybe you can add other habits like smoking and alcohol. So these type of people, they have the hyperstimulation of the sympathetic nervous system, and it leads to high blood pressure. Now, talking about atherosclerosis in simple terms for a common understanding, we can say that it is the thickening of the arteries and the arteries becoming harder. Now, there is deposition of fats within the arteries. There is deposition of some fibrous plaques within the arteries, and this fats, these fibrous plaques, they make the arteries harder, they make the arteries thicker, and the lumen or the space available inside the arteries is reduced. So the space available for the flow of blood within the arteries is reduced. Now sometimes there can be even deposition of calcium in these fatty tissues or in these fibrous tissues, and some degenerated cells in the arteries, the degenerated platelets in the arteries, or the dead platelets, the dead cells of the within the arteries, they can actually stick, they can actually deposit in this fatty depositions inside the arteries. So it will create a obstruction to the blood flow in the arteries. And as the arteries have become harder, the elasticity of the arteries is lost, and so vasodilatation is not possible. So with atherosclerosis, two main things are happening. One is the lumen of the arteries. It becomes narrow. So the blood flows with a force with more pressure. And another thing is the hardening of the arteries, and the arteries losing their elasticity, it further creates the problem. So atherosclerosis definitely is one of the most important risk factors for the development of high blood pressure. Here you can see a diagrammatic representation of atherosclerosis. So first, because of some reason, the artery might be damaged, or it can happen even in a healthy artery. Second, there is the deposition of fats, deposition of cells, maybe deposition of calcium within the artery, inside the artery lumen. And next, you can see that the lumen is narrowed, or the area available for the blood flow is reduced. Narrow lumen. Now, many a times, this atherosclerosis is also a aging process, but at the same time, it is dependent on your food habits. Excessive consumption of fatty food, excessive consumption of sugar, excessive consumption of refined foods, it can damage the artery and it can initiate the process of atherosclerosis. Similarly, smoking is also one of the risk factors which can stimulate the process of atherosclerosis. And this atherosclerosis is one of the important factors to increase the blood pressure. And furthermore, when the lumen becomes narrow, it increases the blood pressure, but at the same time, it reduces the blood flow through that artery. So the organ to which this artery is supplying blood, it would get lesser quantities of blood. Now there are quite a few theories which are put forth why this atherosclerosis it starts. We'll just quickly mention about these theories. Like one is the lipogenic theory, the LDL theory, low density lipoprotein. They can cause atherosclerosis. So obviously it is a dietary factor. You can prevent this dietary factor, you can prevent atherosclerosis. Or sometimes there is a thrombus formation, there is a clot formation which attracts platelets and other cells to that particular part of the artery, which can lead to atherosclerosis. And sometimes it can be genetic, or it can be because of some viral infection, or it can be like just a simple tumor growth inside the arteries. And with that tumor growth like thing, furthermore, there is deposition of fats and other things which can lead to atherosclerosis. So these are a few theories how atherosclerosis is stimulated, how it starts. In a normal, healthy individual, there is a mechanism to control the blood pressure and to maintain it within normal limits. Earlier, we mentioned that there are multiple factors, there are many factors which can increase or decrease the blood pressure. And the blood pressure keeps on changing throughout the day. It's a physiological variation. But our body has a mechanism to maintain the blood pressure more or less normal. So when the blood pressure becomes low because of any factors, because of any reason, if the blood pressure becomes low, it goes towards a lower side, then there is secretion of certain chemicals which are called as renin and further angiotensin. And this renin and angiotensin, it helps to bring the blood pressure back to normal. So when the blood pressure is reducing, going to a lower side, there is secretion of renin and angiotensin, and this renin and angiotensin, they help to increase the blood pressure back to normal. On the other hand, if the blood pressure goes on increasing, this increase in the blood pressure is detected by some baroreceptors in our carotid arteries. The carotid arteries in the neck, they are sensitive to this increase in the blood pressure. There are pressure receptors which are called as baroreceptors in these carotid arteries, and they detect this increase in the blood pressure and immediately initiate a mechanism so that the blood pressure reduces back to normal. So there is a perfect balance in our body in between these two mechanisms. And with the help of these two mechanisms, the blood pressure in our body is maintained within normal limits. So these two mechanisms, the renin angiotensin mechanism and the carotid baroreceptor, they actually influence four factors in our body. The first is the cardiac output, the amount of blood which is pumped out of the heart. So when this cardiac output increases, the blood pressure is going to increase. And when the cardiac output is reduced, the amount of blood pumped out of the heart, when it is reduced, the blood pressure will be lower. The second factor is the peripheral resistance to the flow of blood, or in simple terms, the resistance to the flow of blood in our arteries. It's but obvious that if the resistance is more, the blood pressure will be more, and if the resistance is less, the blood pressure would be less, or it would be lower. The third factor, which is influenced by these two mechanisms, is the urine output, or indirectly the salt retention. So if the urine output is more, the blood pressure would reduce. And if there is more salt retention, too much of salt retention causing too much of water retention in the body, reducing the urine output, it will increase the blood pressure. So salt and water, they have one major role to play in maintaining our normal blood pressure. And depending on this third factor is the fourth factor of plasma volume. The total amount of volume, the total amount of fluids in our arteries and veins. If the total amount of fluids in the arteries and veins is higher, the blood pressure would be high. And if it is on lower side, the blood pressure would be on the lower. So these four factors, they are influenced in a healthy, normal individual by the two mechanisms. The first, the renin-angiotensin mechanism, and the second, by the sensitivity of the carotid baroreceptor. And controlling all these four factors, the blood pressure in our body is maintained within a normal limit. Now, the clinical signs and symptoms of a person suffering from high blood pressure, hypertension. What would be the symptoms? The first and the most important symptom we mention is that hypertension usually is a silent killer. There would be no symptoms, there would be no signs absolutely for maybe a few years, and the person is suffering from high blood pressure. So the only way to find out if the person is suffering from blood pressure, high blood pressure, is to actually measure the blood pressure. Because there can be absolutely no signs and symptoms before the blood pressure increases, or even after the blood pressure increases. Of course, there are some signs and symptoms with high blood pressure, but then they're not very diagnostic of being because of high blood pressure. For example, there can be severe headache, usually in the morning and at the backside of the head, the occipital area, the backside of the head, and morning headache. But then there can be multiple reasons. One of the cause is high blood pressure, but apart from that, there can be multiple reasons for headache coming up in the morning time. So someone having headache in the morning at the backside of the head, we can't say that he is definitely having high blood pressure. He might be suffering from high blood pressure, but we can't say that he is definitely having high blood pressure. So these symptoms, they are some of the symptoms which would come up with high blood pressure, but they are not diagnostic symptoms. So similarly, there can be giddiness, fatigue. Some people, they complain of irritability, unnecessary anger, or even loss of sleep, insomnia, or there can be edema, swelling. But then again, none of these symptoms, they are very specific to high blood pressure. There can be many reasons of irritability. There can be many reasons of lack of sleep, no sleep. There can be many reasons of swelling, edema. But when these symptoms are seen in the patients, one of the things which should come up to your mind is high blood pressure. As I mentioned earlier, the only way is to measure the blood pressure and diagnose the person as suffering from high blood pressure. Some of the other symptoms of high blood pressure can be increased urination, especially increase of urination during night. Now, we mentioned earlier that one of the factors which can control blood pressure is the urine output. So, a high blood pressure person naturally tries to control the blood pressure by increasing the urine output. So, this can be one of the symptoms. But then again, there are other reasons, there are other diseases which can cause increased frequency of urination or even urination during night. But one of the reasons can be high blood pressure. But then the symptoms like breathlessness, or there can be even anemia, sometimes even vomiting and palpitation can be seen in people having very severe high blood pressure. Vomiting can be one of an indication without any reason. Vomiting can be indicative of the person having a real high blood pressure. And then palpitation is actually feeling your own heartbeat. Usually a healthy individual, a healthy person, doesn't feels his heartbeat at rest. But when a person starts feeling his heartbeats at rest, one of the reasons can be high blood pressure, and maybe there can be some cardiac problems, there can be some heart problems, but palpitation is one of the things which can come up. And with this palpitation, there can be heaviness of chest, sensation of heaviness of chest. So these can be a few symptoms which are related with high blood pressure, hypertension. As I said earlier, usually this high blood pressure sets in, the blood pressure increases without any signs and symptoms, and so we call it as a silent killer. So it's always good, it's always better to keep monitoring the blood pressure if you are having these risk factors which we mentioned earlier. So the best way to diagnose is just measuring your blood pressure. Next, moving on to the physical signs. If you keep your fingers on a pulse for a person who is suffering from high blood pressure, you can see that the pulse, they are forcible pulse. With experience, you can differentiate in between different pulse, whether it's forcible, whether it's soft, and many other things. Then the feel of the arteries, when you're feeling the pulse, the feel of the arteries is usually thick and hard. Of course, these things will come with experience. And then the area where actually you can listen to the heartbeats is a bit displaced, displacement of the apex beat. And the heart sounds which we can hear on a stethoscope, they are usually louder as compared to a healthy individual. So these can be a few physical signs which can be noted when the person is having high blood pressure. Now coming to the organ damage, high blood pressure is just one thing, but it can damage multiple important organs in our body. It can damage the heart, including the arteries. It can damage our brain, can damage our kidney, can damage the eyes. So indirectly, it's important to say that someone who is having high blood pressure for a very long duration of time has to keep checking, has to keep monitoring the condition of his heart, his brain, his kidney, and his eyes. So a regular checkup of these organs is very, very important. And maybe initiating some preventive therapies for these organs is also important to prevent any damage because of high blood pressure. So always take care of your heart, brain, kidney, and eyes, those who are having high blood pressure. As far as the effect on the heart is concerned, the most important effect is the size of the heart will increase, which is called as hypertrophy, and it is really a big problem for your heart. When the workload over the heart is increased, the thickness of the heart muscle, it increases. The thickness of the heart wall, it increases. And because of all these things, there is a reduced blood flow to the inner parts of the heart muscle, to the inner parts of the heart wall. So these damages, they can further continue towards the changes of myocardial infarction, or in simple word, heart attacks. So again, one of the major reasons for heart attacks can be considered as high blood pressure. So a heart checkup for a person suffering from high blood pressure is very, very important. Next, the arteries, they're already thick and hard. So there will be increased resistance to the blood flow in the arteries, and this can lead to the degeneration of the arteries. As the blood is flowing with a force, it will further damage the internal part of the arteries, which would further make the arteries thick and hard, and the elasticity will be lost. And the effect of all these things would be a reduced blood circulation, a reduced blood flow to that part of the body, to that organ of the body where the arteries are damaged. And usually the vital organs would be the heart and the brain. So if the blood circulation towards the heart is reduced, it can be a myocardial infarction and heart attack, or if the blood circulation towards the brain is reduced, it can be stroke. These two vital organs, if the arteries supplying blood to these two vital organs are involved because of high blood pressure, then it can be really life-threatening. Next is the effect on the brain. Too much of pressure of blood can lead to bleeding, hemorrhages in the brain. It can cause swellings around the brain. It can cause degenerative changes around the brain. Small bleedings or even small clots can be formed in the brain circulation, which can lead to stroke. So damage of the artery along with the changes, degenerative changes, can cause the stroke. Next, there can be effect on the function of the kidney, directly leading to renal failure, failure of the kidney to filter out the waste products. Kidney can filter out the waste products. Kidney can form the urine at a particular pressure of the blood flowing through the kidneys. So if this pressure of blood flowing through the kidneys, if it increases, then it's going to damage the filtration mechanism, the filtration plant inside the kidney. So it can directly lead to renal failures and total stoppage of the function of the kidney. Over the eyes, again, there can be hemorrhages, bleeding in the eyes, bleeding in the retina. There can be swelling, edema. There can be accumulation of fluid inside the eyeballs. And of course, because of all these things, initially there would be blurring of vision, difficulty of vision, and maybe if the complications go on increasing, there can be even loss of eyesight. So many vital organs in our body, they would be damaged by this high blood pressure. In the end, we will just comment on the management of blood pressure, high blood pressure, without any medication. No medicines, no tablets, but some lifestyle changes can help you to maintain the blood pressure. The first thing is proper weight management. Control your weight. Second is dietary restriction of salt. Reduce the consumption of salt in your day-to-day diet. Then it is tobacco and alcohol restriction, or rather no tobacco and no alcohol. And then changes in your behavior, changes in your lifestyle can help you to maintain the blood pressure within normal limits even without any medication. But these changes need to be done on a long-term basis, on a permanent basis. Then and then only the blood pressure would be maintained normal without any medication. So the last two, they are very, very important: behavioral changes and lifestyle changes, which would again include your practices of exercise and change in the diet. So with these all things, it will help you to maintain your blood pressure. So we stop here about the understanding of high blood pressure, hypertension. Hari Om.